Welcome to the 1619 Project Podcast. My name is Antonio Ruiz, and Thomas Fields, my partner in, well, I won't say crime, partner in this wonderful, wonderful venture. Today we're going to have an abbreviated program because we've covered a lot of these issues before in medicine. And Thomas, one of the things that they start off the chapter is talking about the Affordable Care Act, and being signed, one of the signature legislation under President Barack Obama. And of course, we all know that the Republicans have for the longest time tried to repeal and replace, without coming up with a so-called replacement. And what I found interesting about this is that they repeated so many of the things that were said in medicine chapter. And one of them that stood out to me again is medicine here in the United States is the only high-income nation that does not guarantee some form of healthcare to all of its citizens. Medicine here is a commodity, and access to it depends on a suite of factors, including age, income level, employment status, geographic region, and to an alarming and undeniable extent, race. African and Latino Americans have the highest uninsured rates in the country, and as a result, shoulder a disproportionate burden of the health system's failings. They are more likely to die during pregnancy or from cancers that are treatable when caught early, and more likely to suffer the worst outcomes associated with chronic medical conditions like diabetes. No surprises here, right?
It's sad to say there are none. And it's sad to say that we covered a lot of that. This is, it's an ongoing thing. And, I think you said it quite well. Republicans fought tooth and nail to keep healthcare a commodity. It's a double-headed monster. You've got on one hand, you've got the folks who benefit from commoditizing healthcare, the corporations, the hospitals, the healthcare systems, the insurance companies. On the other hand, you've got people who believe, frankly, that people of color do not deserve healthcare, and they want to keep it that way. So there's a combined force.
Yeah, and it's interesting because they also kind of trace back where a lot of that came from. Post-World War II, I don't want to spend a lot of time on the historical thing, but I just found it really interesting the first time I read this chapter and talking about the emancipated African Americans and the Freedmen's Bureau, which was supposed to basically take care of the transition from slavery to the free status. And just that they just could not bring themselves, this country could not bring themselves to giving healthcare, particularly free healthcare, to African American or recently newly freed people. I know we talked a little bit about this, and you actually kind of touched on it just now. What is this thing that this country has about the idea of having a national healthcare system?
Like a lot of stuff in this country, it comes down to money, comes down to, who benefits from it financially. And so many of the ills that are in this country are race-based, but there's also something very pernicious about this particular issue.
Exactly.
If you're talking about people's bodies, you're talking about their health, you're talking about, these are basic rights. And one of the things, we're couching this in terms of the historical past, but let's bring this up to
yes,
modern day. And one of the things that jumps out at me, which is not in this, is like hospitals and where hospitals are located. If you recall, one of the things that brought the Watch riot on was not just police action against stopping that woman, But one of them was the fact that nowhere in South Central in Southern California, for those who do not know, is where most of blacks were shuttered. And that was a black neighborhood then, and it's less so now because it's becoming more Latino. But it was in those days a black neighborhood. If a kid got hit by a car, it had been documented. It took an ambulance 45 minutes to get there because there were no facilities in that area. So as much as it was about police activity, it was about also getting medical care there. One of the other things to bring up is, are you familiar with Killer King? That's a nickname that they gave King Drew after the riot.
Yes.
They put in a hospital. Well, of course, what happens is we're going to basically give the people hospital. It was underfunded, poorly staffed. It became Killer King because people went there. The neighborhood knew if you went there, somewhat like with the commercial for the Roach Motel. You may go in, but you won't come out. And this is documented stuff.
Sounds like Lincoln Hospital where I grew up.
Well, every black community or a colored community has a hospital like that. In DC, was called DC Central.
That's right.
DC General.
DC General, yes.
DC General. Same situation. Poorly funded, poorly staffed. People go in there as a last resort. King Drew had that reputation. And now what has happened, thankfully, is that after Killer King, one of the county supervisors, Mark Ridley Thomas, was outraged. And he got federal funding, got county funding, got city funding, and they made King Drew into a model. And today, it's one of the better hospitals in this region.
It's a teaching hospital, isn't it?
It's a teaching hospital. Well, King Drew was supposed to be a teaching hospital. Okay,
right.
Always was the case. But again, underfunded, it was ignored, and intentionally so. But today, King Drew has become a model for what can be done for that kind of facility. So anyway, but I maintain that every community of color, if you look at the healthcare, if you look at the hospitals there, I guarantee. And there's one final thing, and this is very pertinent. This past week, Apple TV started airing 5 Days in Memorial. It's based on a book, which has the same name. During the hurricane that swept through New Orleans, Memorial, which was in a black neighborhood, was basically shut down, and they had put together a plan to basically get people out of the hospitals in the path of Hurricane Katrina. Memorial had, as one of the people said, we had a plan for biological, chemical attack, but we didn't have a plan for floods. What happened is it was isolated.
Oh, I think I remember this.
Okay. The thing that stood out, besides the fact that it was isolated, when they tried to basically get people out, they realized they could not get them out because they had been ignored. A couple of nurses had to do triage, but their idea of triage was that they decided what patients could be removed safely. And they gave people lethal injections.
Yes.
45 people.
I remember this.
After the orders had receded, they came in, they discovered that 45 people were killed. Not necessarily by the hurricane, but people had been killed because they deemed them not capable of being moved and they were given lethal injections. Now, 3 of the nurses were, in fact, set up on charges. I believe they were all found to be innocent. And as somebody said, it's a case where it's hard to put it on the nurses alone because this was a systemic wide. Yeah. This crime is a crime against humanity, but it should point to the entire system, healthcare system. And I would just say, I recommend to people, I read the book, I have not seen 5 Days in Memorial, but I recommend people at the very least, if you want to see healthcare at its worst and how it affects people of
Yeah.
color. See
Well,
5 Days Memorial, or better yet, read the article or the book that was based on.
you know, you mentioned, you talk about Drew and probably hospitals like Memorial, where the whole issue of funding is really comes to the core of, because if you don't have really good funding, if you don't have oversight, if you don't have the resources necessary to hire the best administrators, the best doctors and best nurses, you know, you're going to always have problems. And one of the things that in this book, in this chapter, they talk about funding, is this whole idea, one of the central tenets of the provisions of the ACA was an expansion of Medicaid, which is the federal program that provides health coverage to low-income Americans. And at least 12 states, most of them in former Confederacy, I love how they put that in parentheses, refused to participate in that expansion. At least 12 other states, Republican lawmakers have tried to restrict access to that program through cumbersome work requirements. This struggle between using state resources to provide citizens with healthcare and withholding those resources from people deemed unworthy of support has become one of the biggest conflicts in contemporary politics. And I mean, it's one thing, we can have long arguments about the idea of a national healthcare system. But this idea of criminalizing people, poor people, because they're poor, and restricting their access to the resources they need, one, just to survive, and two, is to then build on that survival their lives. I mean, what good is it if you've got diabetes and you don't have access to insulin? If you've got, any number of medical issues and you can't survive, or you can't, get treated. And I just can't understand. Okay, we have an argument about national health care, but this idea that we can't expand Medicaid and then use the excuse that, well, because it would mean they would have to cough up some money. I just talk about crimes against humanity. I just don't understand that. I mean, because I don't think it's just about money. It's something else.
Mm-hmm.
And it's idea about poor people, and God forbid, and there's not only poor Black and Latinos, there's obviously poor whites. It's this idea that the Republican Party criminalizes poor people.
Well, yes, and yes to all of that. And I think one of the failures that we have in mobilizing people in this country to get a better break is, of course, the wedge of race. It's also, and the Republican Party's been very good at that, wedge issues. But what people don't seem to understand is ills that perhaps are aggravated and started in certain communities will always migrate to other communities, and it's going to impact you. You may be behind a gate in certain communities, but you are ultimately going to deal with it one day. And I am really reminded by something about that whole thing. It's this whole thing about, first they came for the socialists, and I did not speak up because I was not a socialist. Then they came for the trade unions, and I didn't speak up because I ain't a trade unions. And they came for the Jews, and I ain't a Jew, so I didn't speak up. And then when they came for me, there was nobody to speak. And that is, again, part of the problem is that we look at ourselves as being these, basically silos, these groups, and those folks, and I put it, again, I look at a lot of stuff as being financially, based, but those folks, the 1%ers, the, whatever you want to call them, the Trump calls them the elite, and of course, unfortunately, he's one of them. He's wearing that, that cloak. But those people who do control the power in the quarters, hey, they look at all of us who are below them as the same. We're only commoditized things. We are only of value when we could be commoditized and monetized. And that's the problem. Until we in this country come to some realization that we're all in the same damn boat. And it probably is going to happen. I'll tell you, I'm making a huge leap here, but it's probably going to happen with this whole climate change. Because one of the things, again, while there has long time there's been racism about where you build plants, where you build these, environmental, issues, it's going to come to haunt all of us globally.
Yeah. I mean, probably a very well-connected issue is people who are unhoused, because then they don't have access not only to housing, but they don't also have access to medicine. They don't have access to healthcare. They don't have access to any way to get mental health services. There was another issue that they brought up, which I hadn't even thought about. Employer-based health insurance, which took off in the wake of World War II, put yet another hurdle between African Americans and equitable health care. They quoted David Barton Smith, an emeritus historian of healthcare policy at Temple University, who said that they were denied most of the jobs that offered coverage.
Yeah.
And even when some of them got health insurance, as the Pullman porters did, they couldn't make use of white facilities.
Yeah.
This idea that, well, if I, and bring it up to date, if I can't get a job that provides health insurance, and even if I did get a job that provided health insurance, there was this, and I'm not sure it's the same today, but I remember a couple of years ago, you had to work 28 plus hours.
Yes.
In order to qualify for health insurance. So what were companies doing? 28 hours. No, it had to be less than 28, more than 28. But it was like it was part-time employment, basically. Or they would just cap it just below 28. And I'm going, what's up with that?
Yeah.
And
what's up with that? If you look at it from the employer standpoint, this is what's so pernicious about employee-based insurance. The employer, that's a big hunk. I mean, it goes up every single year.
Yeah.
So the employer is forced to pay half of it.
Yes.
Or more. And so then what the employer is forced to do is say, okay, so I'm looking at my profits, looking at my expenses.
Yeah.
What's my biggest expense? It's insurance. So am I going to give that out freely? No. So,
No.
I mean, the insurance companies, along with the healthcare system, have thrown the weight of that back on the employer, who of course throws it back on the weight of the employee. That means you don't get it offered insurance. If you do get offered insurance, the premiums are going to be so high, and that's what we are dealing with here.
And the solutions are some kind of a support system from either the state or the federal government, and Republicans will never ever. I mean, forget about this idea of, listen, I know there are people optimistic that one day we're going to have a national health system, and maybe we will sometime in the future. But in the meantime, that's what's the whole point of Medicaid expansion.
Mm-hmm.
That's the whole point of, there've been other proposals that talk about everything from tax incentives to outright grants to, some kind of a support system, so that it allows for people who not just to employees, but to employers, so that they can support providing healthcare to their employees. And every time those things get knocked down by Republican legislatures and the GOP on a national level. So
It's also about wealth distribution.
You're on your own, brother.
Yeah. Well, you think about it. If we loosen up some of the funds that, for example, insurance companies get, and we said, okay, instead of that going to insurance companies, insurance executives, we put that back into the economy. And i.e., if people had the freedom to leave a job and carry the insurance with them, think about what that does to the economy. Think about productivity. I mean, this is not a matter of just equality. This is a matter of, in fact, economic revitalization. I mean, and you're seeing a little bit.
You're taking those dollars from certain people who don't want to let go of those dollars.
And that's true of almost any kind of social movement. When you're redistributing wealth, and that's what social movements do.
Right.
That's what FDR did with the New Deal, basically redistributing wealth. And so of course you're taking out somebody's pocket who often is benefiting from this stuff unfairly. Outsized benefits.
I want to just end with one of the last paragraphs in the chapter. Many forces have prevented the United States from achieving universal health care, including a failure to properly regulate. I want to accent this a second, including the failure to properly regulate the trillion-dollar healthcare industry and a near total unwillingness to grapple with the ethics of a for-profit medicine. Until I'm repeating again what I said in the healthcare chapter, in the medicine chapter, that you cannot have a equitable healthcare system until you stop looking at healthcare as a commodity, because the issues of even what exists today is so subject to where you live, access to those facilities, whether it's a hospital, whether it's doctors and a clinic, whether it's an emergency room. You cannot deal with any kind of creating any kind of equity until you deal with the way you look at medicine in this country.
Yeah, of course.
And that would take a seismic shift because I will tell you, it's not just coming from the industry. There are people who've been convinced today, some of whom would actually benefit from a change in that perspective, because they've all bought into this idea that we have the best healthcare system in the world, and any changes to that healthcare system would get us from number one to number whatever. When in fact, if you look at any measures, we're nowhere near number one.
Well, the optimist in me says it's eroding. Younger people are looking at this healthcare system. The younger people who don't get jobs, by and large, with healthcare,
yes,
are saying, socialism? What's so bad about socialism? I mean, that changes the discussion. And I maintain that you can't have a functioning democracy until you have people who actually have their needs met with their healthcare. That's the reality.
Yeah, it's going to be interesting. Okay, since we've covered a lot of these issues in the other chapter, I'm going to bring this to an end, and we're going to talk after this chapter. Our next show was going to deal with a really interesting title, Chapter 17 and Traffic. So we'll see you on the next show. My name is Antonio Ruiz and Thomas Fields. Thank you very much.
Yeah.